now. We're going to get Dr. Leonard Campos. I know he is on the road as well. Let me bring this up. And Doc, good morning. Thanks for joining me, because I know we're talking about arthritis today. Ups, yeah. Yeah, just unmute your mic, please, Doc, and then we're good to go. There we are. Good morning, Doc.
Yeah. Good morning.
Hi, good morning. Yeah, so we are talking about arthritis today. I know your colleague, Dr. Leonard Campos, should be joining us momentarily. But when it comes to arthritis, how much of our island community is affected by arthritis? Because, I mean, it's almost one of those things where it's no exaggeration to basically say, like, you talk to a cousin, a neighbor, a classmate, someone you go to church with, and they say, yeah, I know somebody who's, dealing with arthritis. Even people that are, relatively speaking, kind of young, right?
Right. Certainly, yes. I'm seeing it more and more in the clinics these days, even in the younger populations. And it's certainly affecting the quality of life of people, and certainly something we want to get ahead of and treat before it progresses to the point of potentially having knee replacements, hip replacements, things like that.
Yeah, I know hip replacement seems to be very, very common in the elderly. We were talking about care for the Manumko last week on Here's to Your Health, but how often do you see locals needing hip replacement?
I certainly don't have a statistic or number, but some of the problems with that is a lot of times we might have to send people to off island, whether it's in the Philippines or the States, sometimes done here, and that gets a bit cumbersome to manage getting people out to the States for surgery and coming back for post-op management and rehab. So there's a lot of issues and barriers with that as well. So, but I don't really have any numbers as far as percentages, but certainly it is, I feel, increasing numbers.
All right. Well, okay. Well, right on cue, and as promised, here is Dr. Leonard Campos, also of New Gen. So, Dr. Len, thanks so much for joining us. And of course, on the topic of arthritis, is there anything that is unique to Guam or our lifestyle, our culture, that contributes to the fact that we have so many people here who suffer from arthritis? Dr. Nguyen was just talking about, various aspects, knee replacement, like things like that. But is there a particular type of arthritis that's very, very common here for our people?
Yeah, so I don't necessarily know. There are some things that are unique to the region, like ankylospondylosis, where we have ossification of some of the ligaments of the spine that you just see more in the region. But aside from that, our complaints of arthritis are pretty consistent across. I think some things that we got going on here is some environmental things that's for us and works against us. For example, we have access to beautiful beaches and things like that. So it gives people opportunity to be active in a non-weight-bearing way. But we also have our issues of heat and shade. So it's harder to get people to go outside and walk and stay fit and keep those joints moving. So we see a little bit more arthritic changes due to that type of inactivity. Mm-hmm. And then Dr. Wen probably could talk a little bit more about nutrition. We have a very high sodium content diet and things like that, and fried foods, which you see a lot of people trying to change on island, with a lot of our chefs and restaurants, as well as our people, our influencers on social media, and all these things that are promoting a little better diet. But at its base, we do have some unhealthinesses in our diet. But, interestingly, you go back 1 or 2 generations and you have generations of farmers and ranchers that grew their own food, that made their own, they had their own livestock and things like that. So it was quite a change in just 1 or 2 generations when you went from growing your own food to everything's being bought produce-wise at a grocery store and things like that, where you have less control.
Sure. Now I don't know if this is just Hollywood, kind of like being a little bit melodramatic, but I like Dr. Campos how you brought about the fact that our previous generation was very, very agricultural, and certainly current generations still continue to farm. But is there anything about that particular work, and say if you do that for maybe a couple decades of your life, it's very very particular for the muscles that you're using, like with the wrists, with the fingers and everything like that. You're plucking, you're pulling and everything when you harvest and everything. Is there anything like that that could possibly contribute to an arthritic condition as you get older?
Well, I think one. Yeah. Go ahead, Dr. Wen.
Sorry. I I think one kind of misconception that I don't want to take too lightly or weigh heavily is, arthritis or osteoarthritis is way an overuse injury or something that always comes with age. But I think there's a lot of things we miss and factors that we can incorporate into our lives that improve our outcomes or slow that process down. And I think the change in our diet over the years, which a lot of processed foods and sugars are inflammatory to our joints and our knees, and that actually degrades our cartilage, and that's what's causing a lot of times the arthritis. And I think those are the things we have to focus on. And in addition, adding more certain nutrients like bone broth and collagen and glucosamine, those kind of things into our diet does help preserve the cartilage in the joints.
Okay, Dr. Campos, you
Yes,
said you wanted to say something on this, right?
Yes, I think definitely nutrition definitely has a key role in this. The doctor over at AMC is doing great talking about those, giving advice on those things. I think when it comes to the original question about does work constitute exercise for arthritis, and I think it's very different. Work, you're doing repetitive tasks over and over again. You might not be strengthening anything to make that better for you. You're just kind of maintaining your ability. So I do like the idea of work, though. You hear this all the time with people that retire. They start to go downhill when they retire because they stop doing activities. And I've had the pleasure of working with many centennials, and I always ask them, what's your secret? Because you've obviously are doing it right. And their key is don't stop moving. Keep doing work, keep staying active. When you retire, pick up a hobby, do something around the house. So in that sense, I think it's good to do those activities to keep going. But let's not, I don't want to tell everyone that their daily work consists their exercise. It's much different. Exercise is very focused. It's aimed to strengthen those areas and joints to make those tasks even easier.
Now, you both have preached, exercise, diet, healthy mindset, being, getting adequate rest, hydration, all as contributing factors for you as preventative medicine. These are very, very simple solutions that you can adopt to hopefully stave off the effects of larger medical conditions going forward and everything. But I know we've heard over the past few years, doctors, of people say there's like super fruits, or there's this miracle vegetable that comes up every few years. Something will say like it's been revealed that that acai bowls are are like an amazing antioxidant, or I believe it was a soursop. They were saying like recently has a lot of very positive medical conditions. Is there anything like that people might consider now that could possibly reduce the effects of them getting arthritis?
Certainly, I think we have to always be careful when we kind of praise or put superfood on a pedestal, and I think that certainly can't always solve the issue, and that's not the silver bullet. We have to look at the total nutrition and focus on more about having a more complete diet and not just focusing on that one food that will bring you great health. So I think we have to be careful with that. You can just looking at acai bowls. Yes, they have nice antioxidants, but you have to look at the sugar content in those kind of desserts. So the sugar content actually might be more harmful than the antioxidant benefits that you might get in that acai bowl. So that's
sure.
Yeah, I definitely agree. We have all these superfoods, but when we mass produce them for commercial use, we have to make it something that everybody wants, and sometimes there's a lot of sugar added to it. But we do have something on Guam that is unique to our region that we could be the super creators of, and that's coconut oil. Coconut oil has been shown to have great benefits all across the board, from topical to ingesting it. And I would really suggest that. I know in our house, we grew up, when you get sick, you put coconut oil on your chest, your neck, your back, you wear a shirt to sleep, and it does a lot. Maybe it's a little placebo effect since that's how we grew up, but I stick by coconut oil.
Mm-hmm. Okay, guys, and final question before I let you go, because obviously, it's a very, very busy day, and you guys have a million things going on at New Gen. So everybody make sure to check them out. They're on social media, New Gen Physical Therapy. But what home remedies or self-diagnoses can we as Guamanians do to maybe say I've got a nagging sports injury that, I had when I was younger. I've got some aches because I've been working for 20 years on a computer. The last year students have been obviously hunkered over in front of most laptops and iPads, they've logged an inordinate number of hours. How can they tell if they might be getting something that's arthritic, or maybe just is it psychosomatic, and they're just like it's just normal joint pain that you can just kind of like do some exercises and properly take care of?
Well, first, Jason, I think I don't want to make everyone think arthritis is something that's necessarily negative. Everyone's going to get arthritis. It's just normal wear and tear. So we're all going to age. I'm looking at this nice diagram on my computer that you guys can't see, but everyone, they did this big study, and everyone over 40, about 68% of them on MRI have disc degeneration, another name is saying arthritis. Everybody over 60, 88% of the population has some sort of disc degeneration or arthritic changes to the joint. So it's not necessarily abnormal. I think when we compound weakness and then inactivity on there, that's when we get the pain. But generally speaking, joint pain in the morning that lasts about 30 minutes, that kind of resolves with movement, is usually going to fall under that classification of possible arthritis. And that could be in the knees, the hips, the back, the neck, the shoulders. So we want to get those joints moving and strengthen them up. And usually that's a good cure or a good solution to that arthritic pain to get rid of the pain component.
Interesting point. I never considered that.
Yeah. One last thing I want to add is if you are in the state of, moderate arthritis in the knees or whatever joints, I think American Medical Center, I and Dr. Luis Cruz have been introducing newer forms of treatments, such as platelet-rich plasma injections and prolotherapy to help regenerate and heal some of the joint issues and repair the cartilage. So we're trying to more go for regenerative rather than just masking with pain and combining that with nutrition. So that's starting to become more of our approach, and combining that with that physical therapy to have a full total approach to healing arthritis or decreasing the symptoms of arthritis.
Yeah, I've seen a lot of people move from doing meniscal surgeries to doing PRP, which Dr. Nguyen's talking about, as far as trying to regenerate that cartilage instead of going in there and removing the meniscus, which is not as popular these days, or trying to repair it. So lots of options Dr. Nguyen and Dr. Cruz are doing over at AMC. And they set you up for success, and then you come over to Nugent and we get you moving and back to function.
All right. Well, gentlemen, thank you so much. We appreciate the time and the expertise and the insight that you deliver here each and every Tuesday. So they are the experts, ladies and gentlemen. And if they've taught us anything, it's, the steps that we take and the actions that we do these days and everything can possibly let you lead a healthier lifestyle going forward. And certainly two compassionate members of our island medical community, Dr. Leonard Campos and Dr. Luan Nguyen. Boys, thank you very much.
Thank you. It was fun talking. Next week, we should talk about e-yoga. It's a new group that's starting up. They do yoga with kids with autism and their families. I think it's a great topic, and they can use some public, some dissemination of information about what they're doing. So I think it's a great program to let the community know about.
All right. Right. That's a great, I can't wait for that. So we'll see you next week then.
Have a great one.
All right.
You.
Thank you.
Thanks a lot, guys.
Here's to Your Health is presented by American Medical Center.
When we throw things away, where is away? What happens to our waste, and where does it go? As a community of small islands